So there's always a question. So once you've had the discussion with your kidney care provider, where does one start? So of course, different people will have different starting points. So an older 70-year-old patient with chronic kidney disease, fast walking 3 times a week might be a good amount of cardiovascular exercise for them. But a 25-year-old who's just been diagnosed with chronic kidney disease, who's quite healthy, he might need to run 3 times a week. So people have different expectations or different limitations, and that will determine where they start from. A good place to start, though, is thinking about what limitations you have. So, for example, if you struggle to walk upstairs, you can start off there by walking up an extra few stairs every day and then building up from there. Low intensity exercises are always very good to start with. So things like walking, swimming, some light golfing, and things like Tai Chi, simple resistance band exercises. And there's a lot of commercially available exercise equipment available, like, for example, the QB under desk pedalers. So if you're, for example, working, you can have it under your desk and do some pedaling. And don't be deceived by some of these equipment. You can increase the resistance quite high with these QB devices. And I've even tried, and you can get quite a good workout and build up a sweat. And a lot of people have exercise equipment already at home. The number of patients I've spoken to, when you start talking about exercise, they say, oh, yeah, I have a stationary bike at home, but they just don't know that it's safe for them to use. So again, having the discussion, starting the discussion, and using what you have is a great place to start. So in terms of planning exercise and goal setting, we've discussed the SMART goals. In terms of how to build it up, so it's important to plan the frequency, so how often you want to do the exercise, bearing in mind we all have different schedules, so how exercise will fit into your daily schedule, the intensity, and how much time you want to spend exercising. And again, I can't emphasize enough to start slowly, because often people are very enthusiastic and they start, and then they may get an injury, injure their knee, hurt their ankle, and then they'll be put off exercising. So it's important, especially if you haven't been active for a long time, to start slowly and build it up. And goals should certainly be easy and achievable. They should be obvious. So if exercise is part of your routine, you're less likely to not do it. So if you say, okay, I'm going to exercise every Monday, Wednesday, and Saturday morning, first thing in the morning, wake up early and exercise, you're more likely to stick to your routine. Whereas if you just do it sporadically, one always makes human nature to make excuses not to exercise. So if it's part of your routine, a lot easier to stick to. Exercise needs to be attractive. So I know myself, when it's raining outside and I want to go for a run in the morning, I'll run in front of the TV. You can use your elliptical pedaler while watching TV. Then, time passes by quick and people can be amazed what you can achieve. And exercise is satisfying if you have goals and you can track your progress towards your goals. So for example, if you maybe want to lose a few kilos of weight, you can track your progress and say, okay, I want to exercise that I can lose 1 kilo every 3 weeks. And then one gets a feeling of a very rewarding feeling when you see that you're actually achieving that goal. But most importantly, exercise needs to be enjoyed. It needs to be enjoyed so that it can be done regularly. So you need to find what you enjoy doing and stick to that. In terms of what we can do as the kidney care team, so we definitely need to advocate for health professionals. So a lot of our teams have dietitians and social workers who are all very important in our team. But because exercise professionals traditionally aren't part of the kidney care team, they're not routinely available. Some units in other parts of Canada do have professionals like kinesiologists that play an active role, not just for exercise, but also in falls prevention clinics and in rehabilitation. So we've just advocated for a rehab assistant in one of our dialysis units who's helping patients on dialysis to exercise. And we can already see that more and more patients are engaging and joining the program and reaping the rewards. We need to ask our patients what they do, and we need to encourage and motivate the patients and enable them to find out what their concerns are and try and address those concerns as much as possible. And of course, building the awareness. So being aware of the guidelines that are out there, being aware of exercise recommendations, and sharing any community events. So if there's a big walk, letting our patients know about it, and sharing online resources, which I'll show you shortly. There's a large amount of online resources available, specifically tailored for kidney patients. but people aren't aware of those resources. So we can expose our patients to these resources and encourage them to use them. This is the photos are we had a kinesiology student helping in our dialysis unit. You can see him doing some resistance exercises with one of the patients, and the other patient in the top photo cycling and doing light weights while on dialysis.
For more wellness resources, be sure to visit kidneywellnesshub.ca. And don't forget to explore our events and resources section, where you can find links to trusted sites developed by others in our community.
And they very much enjoy it. There are yoga classes, live classes, interactive classes, and you can be connected to a community of like-minded patients. It's important to remember, though, when you're starting an exercise program, it's important to address other aspects, so things like nutrition and mental well-being. So the nice thing about the Wellness Hub is it focuses on holistic wellness, so not just one component of wellness, but social connections, psychosocial support, as well as wellness coaching. And there's also discussion forums for patients to interact, and you can be even connected with a peer mentor who's also living with kidney disease. One can't make positive lifestyle changes if you don't also address other things, for example, things like weight and other vices that we all have as humans. So addressing all of these factors over time certainly builds towards overall wellness. A big problem with exercise is maintaining motivation. So often one starts an exercise program, but then over time, one perhaps becomes bored or loses interest. So we really want to motivate patients, and we really want self-motivation. So how can that occur? So again, we as a healthcare team should be supporting our patients, but patients, especially with peers and the kidney community, can be supported to start the exercise journey. Things like exercise facilities, so in the communities, for example, and simple exercise equipment should be readily available. And as I mentioned previously, exercise is best done when it's enjoyed and varied. So group participation and even gamification of exercise has been tried in some places. Exercise that is planned and done with a group is most enjoyed. So I know myself, sometimes when I go to some of the exercise classes I enjoyed, I don't feel like going, but my friends in the exercise class encourage me to go. And then I never regret going to an exercise class because it's also a good time to socialize. And it's quite nice, even in the kidney community, even the virtual kidney community, with the live classes, you can interact with other people who are experiencing a lot of similar problems. And like I said previously, again, monitoring progress is the most rewarding thing. So even if it's just something as simple as closing the rings on your Apple Watch, or tracking your weight, or rewarding yourself after you achieve a milestone, monitoring progress helps to keep oneself motivated and encouraged. So my take-home messages are simple: that physical activity is important. We know it can improve quality of life at any stage in your CKD journey, as well as many other factors of health and well-being. And any movement is better than none, because that downward spiral does happen. No matter what age you're at, no matter what your GFR is, if you don't use your muscles, if you're not active, if you're not exercising, the downward spiral and cycle of inactivity is unfortunately a reality. It's important to start slowly, do exercise you enjoy, and set goals for yourself and build it up over time. There's a wide variety of online resources available, and really enough resources to cater for any person with with physical impairments, with different levels of exercise literacy. So it's important to look, see, find, explore, find what you like, and stick to an exercise plan. And also just really discussing with your kidney care team and finding out what is recommended for your specific condition. It's the best place to start and is highly recommended. So thank you very much for everyone's attention.